When you hear the term private duty used in relation to rendering care in somebody's home, it's a term that really has evolved, oh my goodness, a thousandfold just the last 30 years or so. Once upon a time, it had mostly a reference to nothing that amounted to more than a babysitting service or a means to provide respite or relief for a family caregiver anywhere from 4 to 24 hours a day. But today, things are quite different because the focus is no longer just on what really amounts to babysitting or respite services because we have persons in others' home for 24 hours a day, 7 days a week, when that individual is suffering from some pretty severe conditions or may even be recovering or managing from a catastrophic auto collision. But if you keep your ear to the grind of the long term care spectrum, regardless of where you are in America or perhaps even in Western Europe, you hear some very serious concerns that relate to the delivery of this kind of care. And one of the concerns is that in most states of the Union, you don't find a uniform set of guidelines that relate to home care services. Now, those states that license those kind of home care providers, the guidelines are rather easy to find and enforceable. And in others, the Office of Services to the Aging may produce certain guidelines, especially for those companies that contract with agents of the Medicaid waiver and render services via direct purchase of service agreements. But those who are getting paid directly, often from an insurer or even from a person's own assets, may or may not be in compliance with any standard or uniform set of guidelines. And that is one of the main concerns you hear about when you focus on the term private duty home care. Among the personnel complaints are a lack of attentiveness to the person being cared for's real concerns, lack of staff reliability, and lack of staff preparedness. And much of that may very well be tied to the absence of certain guidelines or protocol from a regulatory perspective. That's why we're proud that as care managers, being operators of a specific training academy that has a focus on those little things that go into the development of the right kind of people whom you would assign to someone's home around the clock. Some of the items that are covered include how personal success in life is tied to your reliability, safe, dignified personal care, sanitary kitchen management that prevents disease, transfer and ambulation, wound prevention, monitoring and management, and quality reporting of your work activity. Administratively, we're also focused on cost containment. Compensation for services need not be an exercise in robbery. We've cared for so many people and supervised the care of so many others for the last 18 years that we've come to understand how we can do it and still be sensitive to the financial concerns of the payer source, whether it is the individual's private asset or perhaps even an insurer. And so when you combine those items together, staff preparedness, cost containment, and of course managerial oversight, you end up with the kind of product that caters to a home care niche a little differently. So when it is time for you, as a health claims manager, independent case manager, or other professional, or even a family member seeking to arrange care for someone you love, make sure you give us a call, drop us an email, and the purpose of that is to make sure you're super informed, that you're getting the most for the buck you're spending, and over and above that, that you can sleep well at night knowing you've made the right provider choice for somebody whose care has been entrusted to you. American Case Management is not only in the business of making money, that has to happen or the bills don't get paid. We're also in the business of contributing to the peace of mind of those who are carrying not just the responsibilities of your life, but of somebody else's too.